you're in Zoom. Oh, good. All right. Justin, are we ready? Okay. We thank you, everyone, for your patience. So welcome to Project Echo, Best Practices for Aging Care. My name is Pam Yankeelove, and I'm the Director of Research and Evaluation at the University of Louisville Trager Institute. And just some technology tips. Hope these work for you. We ask that you go on and turn your mic off, but we ask that you're interactive in the session. So feel free to use the chat. When there's time to unmute, please go on and unmute. If you get kicked off, there's always the possibility of joining via the phone, via your Zoom app, or just going on and calling and putting that ID in there. So please don't leave. We want you here with us. All right, so this is where we tell you a little bit about KCHC and the collaboration with the Trager Institute on Project Echo. So Mona, is Mona here? There's Mona. Yeah, would you like to talk about KCHC?
I just want to welcome everybody on behalf of ECHO and KCHC. And as you can see, that our hope with KCHC is to create community support systems for the older adults in partnership with the existing local coalitions and organizations. And we do an awful lot of collaboration. Also, we want to develop the workforce and concerned community members to empower our communities to become healthier. And I would ask that if you possibly can, stay on for a few minutes, and we will talk a little bit more how we can do these things from what we learned with this presentation today. Thank you, Pam.
Thanks, Mona. So if you haven't been at a Project Echo, and this is your first one, Project Echo was founded by Sanjeev Arora. He's an MD and a hepatitis C expert, and he was noticing that patients were driving 200 to 300 miles to actually have an appointment with him. And he didn't think that that was very efficient, and he wasn't growing the practice or growing the local capacity to actually help patients. So he developed this telementoring platform about 15 or 16 years ago. And the idea is to move knowledge, not patients, so you can build local capacity. And there is a rhythm to a Project Echo. There's usually a case-based learning opportunity after a didactic. So we have a didactic, then we have a case, and then we all learn together. It's a teach all, learn all approach in the Project Echo, where we try to teach best practices in interdisciplinary team-based care. So the Project Echo tends to be more micro-focused, and the KCH tends to be more macro, community-oriented. And together, we get to focus on the person, everything in their environment, and the community in our Project Echo. All right, so one of the ways we take attendance is by asking you to go on and put your name and your organization in the chat box. So I think some of you guys were doing that while we were working on some of our technology issues. So if you haven't done that as of yet, go on and put your name and your organization and your pronouns, and it helps us get a better sense of who's in our learning community and get to know one another better. If you haven't done so as of yet, you also want to check your name to see if your name is correct under your Hollywood square, and go on. And the way to do that is to click on the three little dots in the upper right-hand corner of your Hollywood square. Click on it and go on, and a dialog box will come down. You'll click on rename and change your name. We are offering an attendance certificate. You can receive an attendance certificate for 1.5 hours for today's session, and you have to go on and complete the Zoom poll at the end of the conclusion of today's session, where you actually let us know that you would like one of those. Today, we have a presentation on integrating behavioral health, primary care, and lifestyle medicine, a holistic approach to well-being. And we have two presenters today. We're so lucky. They are from the Trager Institute. Let me tell you a little bit about each one of them. So Dena Wilson received her MSSW from University of Louisville Kent School of Social Work and Family Science and is a licensed clinical social worker. Dena is currently the Associate Director of Behavioral Health at the University of Louisville Trager Institute Optimal Aging Clinic, as well as is a practicing therapist. When she's not working, she lives on a working farm that raises bison. And then we have Kristen Neises, is a family nurse practitioner and graduate of Spalding University. She is a Geriatric Academy Career Award, also known as GACA, at the Trager Institute, and she is also faculty at the University of Louisville School of Nursing. Her project as a GACA focuses on age-friendly lifestyle medicine and healthcare transformation. She's a newlywed and is enjoying her new chapter with her new husband and dog. So thank you so much. Welcome, Dena and Kristen. We're so glad to hear from you and learn from you. So when you are ready, you can take over the microphone.
Thanks, Pam. I'm really excited to be talking about this topic today, integrating behavioral health, primary care, and lifestyle medicine, integrating those and creating a holistic approach to well-being. So the prevailing tendency in today's healthcare system is to treat medical and behavioral health conditions, including mental health, as if they occur in different domains rather than within the same person. Although mental illness should be treated in conjunction with other medical conditions, it often goes undetected and undertreated by healthcare providers who are confronting an already long and often complex list of problems. As a clinician who was trained in siloed healthcare and educated in conventional medicine, I saw how much the outcomes of my patients improved when I joined a clinic that provided integrative, holistic care. And when I started adding in lifestyle medicine, I was astonished by the positive patient experiences. They were so interested in the model provided because they recognized the discord in our current healthcare system, and they wanted something different. They wanted to be heard, and they wanted to be the center of their healthcare. So today I'm going to start out with some definitions, so we're all kind of on the same page when these terms are mentioned. I think we have a wide audience today, and some of the terms can be misunderstood because they do overlap so much. Then I'll explain how behavioral health, primary care, and lifestyle medicine are so connected and why they should be integrated. We'll talk about some of the barriers and the solutions to make integrated health a reality. And we'll explore some of the current successful models of integrated or collaborative care. And with the information, hopefully, will empower you to use your voice and expertise to transform healthcare with us. I could talk about this topic for hours, but I only have 15 minutes, or maybe even less now that we're a little behind. So let's get started. First one is holistic care. What is it? It can also be known as whole person care. And instead of focusing solely on treating the specific symptoms or isolated medical conditions, it considers the person as a whole, taking into account their physical, mental, emotional, social, and even spiritual dimensions. So by adopting this approach, healthcare providers aim to enhance the overall quality of life for individuals, promote their health and wellness, and contribute to a more patient-centered and compassionate healthcare system. Next is lifestyle medicine. This is a really holistic approach to health that is evidence-based lifestyle interventions as the primary treatment to prevent, treat, and often reverse chronic disease with intensive change. It works with 6 pillars of health. You can see those to the left. Nutrition, physical activity, not surprising, stress management, quality sleep, quality social connections, and avoiding risky substances like tobacco and too much alcohol. And what is integrated healthcare? This is also known as collaborative care models. And this is really a system of care where you have mental health, medical, primary care, health, access to community resources to really address the person as a whole, not just one aspect of their wellness needs. And medical and mental health providers collaborate with each other to coordinate the assessment, the treatment, and then follow up on those outcomes and social determinants of health needs. There are some key elements of integrated care, a lot of comprehensive screening and assessment, identifying a team that includes physical, primary care, behavioral health, team members who are patient-centered and provide those opportunities to collaborate and coordinate the services for the patients. Lots of communication and development, shared development of the care plans, and also the care coordination and management to ensure that the care is quality and provide support not only for the patients, but also for the providers. And then we really engage the patients. They're the center of their care. So we want to engage them in being a part of the care planning and the self-management. And then the team members do communicate with between the providers, the patient. We look at the outcomes, monitor those, and then make referrals to any of the needed resources for the patient in the community. That sounds great, but why isn't everyone doing it? And I think that there are a lot of barriers. A study in the UK identified some common barriers. Of course, not surprising, limited resources. And this isn't just in financial incentives, but also shortage of staff. We know how hard it is to staff the healthcare facilities already. So that's certainly an issue. A perceived increase in workload. We're doing more for the patients. So some might perceive that as being an increase in the workload, that their load is already maxed out. And then a lot of organizations not committed to change. And I think that this is really because of a lack of education on their part, and change is hard. We know that. Non-person centered care. So lots of different priorities for healthcare organizations. A lot of times the money can be one of those, but there's a lot of other priorities out there. And so that was identified as another barrier. And then unfamiliarity with collaboration. Again, I think this is a lack of education, lack of understanding, lack of interest in cooperation, uncertainty over roles and responsibilities because they just don't really know how it works. Can have some tensions in interprofessional teams, and again, fear of change. So what is the solution to these barriers? And I believe the solution really lies in spreading the evidence of the benefits of integrated care, spreading it to our organizations, educating healthcare providers, educating the public to push for that change. So we'll talk about some of the benefits of integrated care. Starting with improving patient outcomes. Mental health problems are often overlooked, and those with serious mental illness die on average 25 years earlier. So many people with mental health problems have comorbid medical problems, and providers collaborate more effectively in this model. Patients are shown to be more engaged, and this can improve patient outcomes. Primary care is often the first place a person presents with a mental or behavioral health disorder and identify those needs for support. And it allows symptoms and needs to be more easily recognized and treated when they emerge, which can reduce the duration and intensity of treatment required. When patients' mental illnesses are effectively addressed, they're better able to fully participate in programs to manage their chronic medical illnesses, decreasing their risk again for continual and new medical problems. Next is it saves money. Research shows that cost offset is greatest when behavioral and primary health care are integrated. In fact, effective integration of medical and behavioral health care could save $26 to $48 billion annually in general healthcare cost. Next is it reduces the stigma related to mental health. When you have an organization that that allows for access to behavioral health, that talks about it, that shows the importance of that health care for the whole person care, then it reduces that stigma, and patients are much more likely to seek out that care. It improves access to care. Again, when you have it there on site, we know that behavioral health, mental health access is a nightmare in the country. And so having that on site, being able to identify patients that are maybe more high risk and need that care sooner than they might get in the community, sometimes 6 months out in the community to get that care. So being able to communicate that with our team and get those patients treated is really important. And it increases patient and provider satisfaction. The ability to get both physical and mental health care at a familiar location is comfortable to patients, and it reduces duplicate assessments, again, cutting cost. Collaborative care, particularly when it's co-located, also has a benefit of saving time and increasing convenience to both the patient and provider, and being both on site or at least committed to an increased level of communication at the minimum. The amount of time needed for referrals, transportation, and retrieving records from one another will be reduced. Okay, and so here you can see, we'll talk about a few successful models of this. The first one is the Trager Institute, and if I could figure out how to zoom in here so I can see this closely. Well, I can't quite see it, but I'll say really starts with the referral. Let's see. Yeah. Starts with the referral, of course. Then we have the assessment, whether it's in the clinic or even a home assessment. We meet for case conceptualizations to discuss these patients. Working together with our transdisciplinary care team can include geriatricians, nurse practitioners, pharmacists, dentists, mental health clinicians, social workers, social services, community organizers, and community health navigators, and working together with the patient to create a care plan, implement that care plan, monitor outcomes, and then the cycle continues so that we're getting the patient the best care that we can. Another model. Thank you. Another model is at the AIM Center at University of Washington. Again, the patient is at the center of this care. You have the team members who are working together with the patient in frequent contact to come up with the care plans for the patients. And the next one really excites me, a big organization, the VA. Again, you can see the patient is at the center of this care model, and their aim is to really improve the health and well-being of the veterans, and to address lifestyle and environmental root causes of chronic disease. And so the VA shifted from the disease-centered focus to this more personalized approach, and it engages and empowers the veterans to prioritize healthy lifestyle changes. So it's a really great thing that they're doing. And then why lifestyle medicine? How does this tie in to whole person care? Why do I think it should be integrated? First of all, it's evidence-based. It's not earth-shattering that exercise and healthy eating are good for you, but now we have tons of evidence-based studies that show specifically that it improves outcomes for patients. And evidence shows that 80% of chronic diseases and premature death could be prevented by lifestyle change. It targets underlying issues, not just the symptoms. Getting to the root cause of the illnesses, and it's sustainable. Sustainable healthcare promotes lasting health practices when implemented correctly, and it empowers patients individuals to make informed choices, to be educated on how they can improve their health and not just be on a million medications for their symptoms. And when we integrate behavioral health and primary care with lifestyle medicine, it can help with the coaching and behavior changes that lifestyle changes require so that it is sustainable and lasting change for them. And it improves physical and behavioral health outcomes. Heart disease, diabetes, stroke, dementia, cancer, some of the top leading causes of death in the US are all influenced by lifestyle choices. Not coincidentally, 80% or more of all healthcare spending in the US is tied to the treatment of conditions rooted in unhealthy lifestyle choices. So in addition to why, again, it helps cut cost. So this approach to health integrated with primary care and behavioral health services can make such a huge impact on our patients' health outcomes. So if you want to learn more about lifestyle medicine, the American College of Lifestyle Medicine is offering this course for healthcare workers. You can go to this website and learn a lot, not just for your patients, but yourself and your families. One more slide. Thank you. And lastly, I just want to say that the train, or in this case, the subway, is coming. And everyone wants healthcare transformation. Media is making that health knowledge more available to the public, to our patients. And it's a hot topic. So we should learn about it, and we should use our voices and jump on the train.
All right. Is that the final slide? I believe so, right?
That is it. Yeah.
Oh,
And
thank you so much.
Justin, I think maybe I have a typo in the no, I think that here, I'll copy and paste it. I think that there's a typo in the link that you posted on the chat.
Oh, there is. Just one extra T, I think. There we go. All right. Thank you very much for your good eye on that. All right. Thank you so much, Kristen. Is there any questions or comments? Any woohoo? Yes. 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 This sounds good. Yeah, there we go. Yeah, I like the way that you said that we need to use our voice. I mean, I guess from my standpoint, that means that if we're in a healthcare setting, we should be asking for this type of integrated care and whole health perspective. That even if we're not, we should be trying to push the envelope to kind of advocate for ourselves and advocate for the healthcare system. And if we are involved in providing health in our organizations, whether it's a social or healthcare organization, that we should also be really focusing on our consumers in a whole health perspective. And even if our organization isn't there, that we can get training like this to help move that needle and get people to start thinking in this way, that we should be looking at the bio, psycho, and the social perspective of things. Comments? Any other comments? That's an excellent presentation.
Pam, can you see Sabine has her hand raised?
Oh, I'm sorry. Yes, I cannot.
Yeah, thank you. I just wanted to say a couple of things. One is there also an approach? I think we approach the change of this culture change to go into whole person care and patient-centered care, integrating behavioral health and lifestyle medicine with primary care from just the provider perspective or from the organizational perspective. How are we approaching it from the patient perspective? Because I think if the patients if we as patients start pulling that that's what we want, leveraging that power so that healthcare organizations are getting on board. That was one of my comments. And then the question is when I talk to administrators or work in medical clinics, is how do you overcome this perceived barrier of this is going to be more work, this is going to be extra work, we don't have time to do that, when really at the end of the day, once you get this started and you get a rhythm and then operationalize all of this, the care is better and the work is less for everybody. Because you have more providers, you have a team of people who can help each other out, and everybody practices to their highest level of ability.
I was lucky to come into an organization who already had that structure. So maybe leadership can, or some of the other team members can speak a little bit more on it. What I know, at least from being a clinician in the clinic, is that, just starting, because it doesn't take an organizational change to provide whole health care. If you don't have that integrated team within, you can build relationships with outside team members, people who you trust and who you feel comfortable communicating with closely. And then as far as integrating lifestyle medicine, just doing it, just bringing those concepts into the care of the patients. And as far as approaching the organization for change, again, I think I would say that the approach that has worked for other organizations, can't speak again for Trager, maybe they can touch on that, but for other organizations who I've talked to about this, it really is a matter of bringing the evidence to them that's showing it cut cost, it improves patient outcomes, it improves patient satisfaction, showing that evidence. If they don't get on board with that, it's it may be an ethical problem, but I think that it can be quite a challenge. So maybe Pam or Dr. Furman, maybe you all can speak on that as well.
Yeah, let's see. I thought maybe Dr. Fall was going to jump in there. She looked like she
Or
was.
Dr. Fall, I didn't see her on that.
Did you? I think those were all some very good points that Sabine had. I'm glad Sabine actually asked the question and then had the comment as well, and that yes, that you addressed it. Yeah, it's a journey. It's always a journey because you have to change a variety. You have to change the minds. You have to change the training. You have to change the system in which you're working. And so, as you said, you began in a very siloed, that's the way you were trained. And so you came out of this training and then you went into several environments where you experienced different levels of the integration of it. But then when you came to Trager, you also experienced everybody on site working together. And so it requires the payers too to be a part of seeing the value and being able to look at the whole health, as you said, from a cost saving perspective.
But I do think you have to have a champion because everybody is going to be, it does take time, it does take this, everybody's going to say this and this and this and that and this and that, but you have to have someone that's just going to say we're going to do it, like that's it, and just do it, because and to have one person that has, a team would be great, but if you have one person, if you're presenting to this whole group, you just have to kind of see who's shaking their head and then go to that person and just work with them and make it happen. Because it's hard to get everybody on board. And so sometimes, doctors don't want to be team players and this and that. And so, you just have to have a champion just to kind of keep it going and make it happen.
Yeah. And I will say that also, oh, sorry, Dr. Fall, I didn't mean to, you go ahead.
No. I just want to say that one thing we've learned is that if, and I think the person who talked first made that statement, is that patients need to require this. They need to require this type of care. And if it's almost like a public health promotion kind of strategy, if patients require it, then providers have to follow through and provide that care. So it's really on us to make sure we get the care that is, like Kristen was saying, integrated and holistic.
Yeah, and I will say that I think the case that I will present will be a really good success story and an example of this. And I will also say that we can present all this evidence and all these reasons why it's better and why it's more cost effective and all of that. But I will say, as a practitioner, and Kristen will probably back me up on this, that seeing and doing is believing. Once you get an opportunity to start doing it this way, it is so much easier and it's so much better. And as the patient that I will present will demonstrate, the patients really, really benefit from it.
Thank you. And I think we have two other individuals. I think we have time for two other questions or comments. So Karen, I think you had your hand up first.
Yes, thank you. My question was regarding patients as well, and I've worked with nonprofits where we were trying to get people to receive care. And one of the number one things that I could see with patients was that the access of ease into the system. And then
Oh, I think you became muted. Or no, she's frozen.
type of care they're going to receive. So as I listened to the presentation, I just kept hearing just one. And we used to try to break down everything for the patient. And sometimes we would actually just on one little call, let them know that this is what we're trying to achieve for you. Because when you're overwhelmed with sickness, mental health issues, and you're wanting healing, and the actual provider may be talking about integrated health, but sometimes that doesn't translate to patients. What is that? And I don't know, is there something that, a very brief, this is what we want to do for you. I saw the VA when they had the various circles. That looked very simple to me, that or patients could understand that. I'm just curious, as when it starts with a referral or how this starts, that it's so important, and you may already have that. It's so important to just break it down to the basics for the actual patient.
Mhm.
Yeah, sorry. A lot of what you said cut out, but I think I got the gist of what you were saying. Thinking how to sell it to the patient and break it down where they understand. In my experience with the patients, when focusing on what matters most to them, figuring out the why, and taking small steps with them, really spending the time to educate them and show them what's available for them. So, and I think, a lot of times it can be, this kind of care might be all or nothing for some people. And I think that the approach that at least worked for me and my patients was to take just small steps. And that really helps them with their confidence, seeing the goals be met, and then taking the next step, and just small steps, and showing them that any step towards that side of care can improve their outcomes. So
Thank you. I think we have one
I don't
more
know if that
comment.
answers your question completely.
We have one more comment from Shelby. Shelby's our physical therapist from Fraser inside of Trager.
Hello, everybody. I just also totally think this is a great idea, but also coming from our point of view as physical therapists, really wanting also to be kind of on the preventative side of medicine. And I think this is like huge, because if you have that system that is constantly checking in, like those pictures that you showed, Kristen, just constantly checking in and catching things even before they even develop into this big lifestyle habit. I just think that's so important, and really a big change, like you were talking about, Pam. It does take time to change and have that different approach to medicine, but I just think that in that preventative role in this model is just really excellent. So no question, I just wanted to add.
I'm glad you did. Thank you so much. All right, we're going to thank you, Kristen. We're going to move on to hope you stay around. Everybody continues to stay. We're going to have Dena go on and present a case now. Dena Wilson. And I'm going to be taking the recommendations.
All right, Justin, am I to share, or do you have it to share? Oh, awesome. Thank you. So as I mentioned, this case is going to be a really, I think, wonderful example of the benefits that patients experience with integrated care, and also a lot of the elements of lifestyle medicine that Kristen spoke about. Okay, so this is a person, and Kristen, you may be able to remember who this is based on some of the details that I provide. But this is a 74-year-old white cisgender heterosexual divorced female. She lives with her daughter and her daughter's family. Some of her, and we'll get into kind of the nitty-gritty of how I came to see her eventually, but some of the diagnoses and conditions that has experienced are, a lot of this is related to chronic pain. And a lot of that is connected to some back injuries and some back surgeries that she's had, a series of surgeries that have really not only caused chronic pain, but also limited her mobility substantially. She also has hypertension and some other kinds of endocrine issues with some thyroid problems in the past. And I've been working with her as a therapist, working on her anxiety and depression. She has a remote history of a bipolar diagnosis, but I have not experienced that in my work with her for several years. And then you can see her kind of clinical measures there. Her blood pressure is well controlled, at least on this reading. And her A1C is in a good range too. Okay. Oh. Is this the next slide? Oh, okay, yes. So I already went over a little bit of this, but due to multiple back injuries and surgeries, she has a lot of difficulty with her gait and mobility. She uses an upright walker. She's been working really hard in physical therapy to try to transition into using canes instead of her walker, but she's currently unable to drive because of her mobility issues. She does not have any cognitive impairments, but she does describe some kind of difficulty thinking clearly when she's experiencing, severe pain, or when she's feeling really anxious. Sometimes her ability to think clearly is impacted by that. Her, chronic pain and muscle spasms are really the main underlying physical medical condition that she's dealing with. And, it causes her a lot of distress, impacts not only her mood, but also her relationships with others, and has also contributed to a pretty significant amount of social isolation. Her pain is currently better controlled. She had a pain pump, started using a pain pump, I think that's been about 8 or 9 months ago, maybe a little bit longer than that. And she's been weaning off of some other pain medications since that time and has gotten a lot of benefit from that. Although she reported kind of having a healthy weight throughout most of her life, she did have a pretty significant weight gain with the onset of her back injury and the mobility issues that she experienced as a result of that. And the weight gain was also really a significant impact on her self-esteem, which in fact impacted her mood as well. But she's recently had some really significant improvements in her diet, and I'll get to that when we get to that slide. Okay, so social history. She did attend some college and took some business classes, but she owned her own business. And when she was living in Ohio, she's a very, very talented artist, and she had her own kind of art supplies and art classes business that she ran for, I think, more than 20 years. In terms of advanced directive and living will, we don't have that on file, but her daughter is very involved in her care and serves in those roles in terms of taking care of those things for her. She's unable to drive, as I mentioned, because of her spine surgery. But part of one of her goals with continuing with physical therapy and occupational therapy is to be able to resume driving. She really wants to be able to drive again, but she's currently relying mostly on her daughter for transportation, just to the store and also to all medical visits. We sometimes meet via telehealth for that purpose because it doesn't require her needing any kind of transportation. So in terms of financial economic stability, she has significant and sufficient financial resources from her time working and retirement benefits. But she currently now lives with her daughter, and they've made this really, really wonderful accessible basement apartment in her daughter's house. And she moved to Kentucky from Ohio, where she had lived her whole life, about 3 or 4 years ago after the back surgeries required her to have more assistance. There is some conflict, even though she does have this ability, she has financial stability living in her daughter's house. Sometimes she feels a little bit micromanaged about how she's allowed to spend her money. So that sometimes causes some interpersonal conflict too. Okay, psychosocial. She does report some anxiety and depression over the lifespan. As I mentioned before, she does have a historical diagnosis of bipolar depression. But in my several years of working here working with her in therapy, I have not really noticed anything that I would consider falling under that diagnosis in terms of manic episodes or anything like that. But she did go through quite a few changes in midlife with a divorce that caused significant depression at that time in her life. And then with the back injuries and surgery and all of that, that really, the depression really resurfaced at that time. She does not have any substance use currently, doesn't have any history of substance use. That's not an issue for her. She does identify as Christian. She does not attend any formal or consistent services or belong to any religious organizations, but she does reference her faith as being important to her and a benefit. Another kind of cultural identification that really she relates to is her husband was a Vietnam veteran, and so she was a military spouse for about 25 years. Her daughter was also in the military. There are a lot of military members in her family, so she does kind of relate to that kind of culturally, which is has been a big part of her life. I mentioned before that she had graduated from college and she owned her own art supply business for a lot of years. She's a really talented painter and seamstress. She knits and sews and crochets and makes jewelry. And she also used to practice woodworking that her dad taught her when she was a young girl. So she's very involved with a lot of crafts and using her hands and being creative. She's been divorced for more than 20 years. She has 2 adult daughters and 1 son from that marriage. And as I mentioned, she lives with her eldest daughter for the past 3 or 4 years in a basement apartment. I've been there. I visited her house before. It's a really lovely setup that she's got. She has one of those stair things that kind of you sit in the chair and it brings you up the stairs, so she can get up and down very easily when she does want to join her family. And she also has a really lovely craft area. She's got her sewing machine and all of her supplies where she can do those things. And then also her pet cat, who I've met many times also. It's a good source of support for her. Okay, so some of these are a little redundant. No, her history of substance use or smoking. She's still going to PT weekly. She's transitioned over. She's had several rounds of physical therapy. She did aqua therapy for quite some time, which she really was really benefited a lot from. She does go for brief walks with her walker down the driveway to the mailbox once or twice a day. She has attended a few yoga classes in the past and is interested in engaging, but she's a little bit self-conscious about her mobility and attending yoga classes. We've talked about, and she's actually finally now open to coming to some of our chair yoga classes that we offer at Trager. And I reassured her that there are other people that sit in the chair while they do yoga, and she's really excited about the physical benefits of that and also the social benefits of that. She's had some really good recent improvements in her eating habits that had led to the weight loss. She'd kind of been using food as a coping mechanism. And she really enjoys food, and she really enjoys healthy food. And she and her daughter both attended Mona's Flourishing Together classes, another service that we offer at Trager. And that really kind of got the ball rolling for her. And she's really made a lot of changes since then. And I think she's lost about, not that weight loss is the total goal of eating healthily, but she has lost about 20 pounds in the last couple of months, or less, maybe 6 months, and has also reported, a lot more energy and just feeling better in general by eating better. She does take all of her medicines. She's really committed to minimizing medications. She's very invested in any kind of lifestyle changes or alternative methods that she can use to manage conditions versus just taking medications for it. I mentioned she's already been weaning off of her pain medicines, and she notices that the physical therapy and increased physical activity, as well as just a healthier diet, are helping her not require as many medications. So that's been great. And so in terms of her source of care, she is kind of the role model for all that we have to offer at the Trager Institute. She sees a geriatrician at the Optimal Aging Clinic for her primary care. She also saw Kristen several times when Kristen was with us. She does not have any difficulties or anything with getting medication. In terms of the medication access piece. But access to mental health services, she's been working with me now for over 2 years. We started out seeing each other weekly, and as she has progressed, we've progressed to bi-weekly, and right now we're just checking in about once a month just to see how things are going. I will say that to kind of reference our holistic, interdisciplinary care, I developed a really good working relationship and communication with her and her daughter in my time with her, and oftentimes they will still kind of use me as a first point of contact. And I can then sometimes communicate that to other folks in the office. So she's really benefited from having multiple providers in our clinic. she and her daughter are both huge advocates and proponents of their experience at the Optimal Aging Clinic. You know, her daughter will tell me that in Kroger, she's telling people, oh, you have to go to Trager. Mom has gotten such great care at Trager. You know, she's so much happier. They, in their time through just better management of her medical conditions and also through therapy. One of the issues that we talked about early in therapy was this conflict between them, you know, as part of the her moving into her daughter's house and the interpersonal relationship changes and dynamics, and they were experiencing a lot of conflict. That has really resolved and improved, and so they've seen the benefit physically, emotionally, within relationships, all of those things. And then dental access is not an issue for her. She sees a dentist regularly. Okay, and so environmental, I think I already talked about some of this, but I've met with her in her home several times. There aren't any fall hazards. She's got a really great little apartment with the chairlift and all of that. And her bathroom is accommodated with one of those tubs that you can kind of open the door to and get in and fill up. There's smoke detectors and all of that. Her space is very well organized. And then in terms of the stressful environment, I was just kind of talking about that transition, as you can imagine, from living independently, you know, until you were 70, I think 71 or 72 years old, and then moving into your daughter's house was a big transition for them. And there was a lot of tension around that transition. And that has really, really, really improved over the last couple of years. And she and her daughter both really comment on about how much better able they are to just enjoy each other's company now. Okay, so this is kind of the summary of all the collaboration that she's gotten with her experience at Trager. Her PCP is at Trager and her therapist is at Trager. She's also more so in the beginning, they haven't needed as much in the beginning, but we also had a Flourish Care navigator, which is one of our social work interns working with them early on to help kind of navigate access to different kinds of resources and services. Her daughter has also participated in our caregiver support program at Trager and has really enjoyed that participation. They attended the Flourishing Together classes at Trager and loved that. It really jump-started her transition to eating healthier and just being more mindful of those things. She is currently enrolled to start the next session of art therapy classes that we're going to be offering in January. I kind of had to talk her into that a little bit just because she's a really talented artist and I think she felt a little bit uncomfortable in that environment. But I really reinforced to her as someone who has seen the art therapy or the art classes. These aren't art therapy. This is just more of a social art class. The kind of social interaction that the participants of that have. And it also kind of represents an opportunity for her to be a little bit of a mentor, you know, to be, you know, in the class, but also provide support to others that aren't as comfortable with painting. And she has also, as I mentioned, finally, and we've been sort of just addressing this and backing away from it for a while now, but she is finally kind of on board for trying out a Tai Chi class and trying out the yoga class. And I think a lot of her readiness for that now has come over time. And also, I think, you know, some of the recent changes that she's made that have really made her feel more self-confident have made her a little less intimidated to try to branch out and try some of those things that feel a little scary to her. And these are just her medications. We don't necessarily have to run through these, you know, all together, but there are some medications for her pain and some medications for her high blood pressure and some medications for her mood that are all part of that. And so, you know, I guess for an overview, you know, I already kind of went over everything, but I didn't necessarily, you know, I use this as an opportunity to kind of present a success story. So we don't really need as many recommendations as we typically need for kind of how to connect this patient to more things, because she's really getting that here with us. But I did kind of have a question. We've already kind of talked about this, you know, about how providers in the healthcare system and also patients can reduce the barriers to integrated care. And I think we already kind of had a pretty good discussion about that ahead of time. But the only question I did have for her, and if anybody out in the community has any recommendations, we're making some progress, but she is an example of is a common example with another patient that I work with that really, when we talk about all the lifestyle medicine pillars, the one that they struggle with the most is that kind of social engagement. And for both of the people that I'm talking about, it's because of both of them moved from another environment where they lived into a new environment where they don't have those existing social connections. And both of the people, this patient and another that I work with closely, also have mobility issues, one with a walker and one with a wheelchair. And they are really very self-conscious about kind of dipping their toes into social environments, because of that, what they perceive is other people being uncomfortable with their mobility issues. So that's the only kind of recommendation. I mean, she's doing great in all of the capacities and she's making a lot of progress on the social front, but that's really the only, if anybody has any specific recommendations on that for her, that would be wonderful. And I know I talked fast, but I also know that I was responsible for us being delayed because of my technology issues. So I was trying to get through it quick.
Thank you so much, Dena. And you're right. We did go on and do question 1 and question 2. Does anybody have any ideas about that? How do you increase social engagement and physical mobility for individuals that have this limited mobility?
Yeah.
So this is Barbara. Can you all hear me?
Yes. Mm-hmm.
Yeah. So I was wondering if, since she does have mobility issues, she's self-conscious about that. Would she be interested in any online or app facilitated social social engagement opportunities? Because there are some, that are available.
Yeah, that's a great idea because her daughter has helped her and she has gotten used to, because we have probably every other session we do telehealth. So she's learned to kind of navigate that. I think she would be open to that, especially she has a lot of special interest. It probably would be easy to find her some sort of online special interest kind of group, around crafts or jewelry making or something. So that's a great idea. Thank you.
And she could also, join the Tai Chi class too at Trager using the online. Yeah, because that's a hybrid class. Yeah. And there's other classes like that as well.
Yeah,
I think it might be. Go ahead, Mona, you're fine.
I think there's actually some that are towards senior citizens too. At one point I had that link and I can look for it, but I think that's a really good idea.
Mm-hmm. Mm-hmm.
I was just gonna say too, if there's a location of other than Traeger and there's a resource that she can go to, maybe just calling that location and seeing like what the access points are. Like, is there a ramp? Like, is it all stairs? So she can kind of know ahead of time, like, hey, I might need to ask my daughter to come with me in order to get in, or just kind of help her like send those thoughts ahead of her if there's another location where she needs to go with her walker. That way she doesn't feel stuck or trapped when she gets to that certain situation.
Very good point. Yes.
Dena, I'm kind of, Karen and I are on the same wavelength here from her question in the chat. Did she stop going to church when she moved? Because I'm wondering if maybe finding a church community of, similar to what she left might be helpful, but also and this could be a bad idea, but maybe her and her daughter would want to go to church together, or one of her other children is something to do.
Yeah, I don't think really kind of regular attendance and it was ever a thing for her, but she does kind of, she references her belief system at times when we discuss other things, but that's a good opportunity also to kind of locate something that she could be involved in the community. Where the community that they live in, her daughter is also very involved and they know a lot of people. And so I think that could also be a good.
You're also making a good point about how you encouraged her to go to chair yoga and, but she hadn't seen it yet or seen it in action. And so that kind of like, the anticipation of all the things that even Shelby was talking about, will I be able to get in? Will there be enough space for me in with my chair or my walker, or, that makes us think that maybe we should be doing, maybe we should be putting like little excerpts out or little pictures or things like that so that people can actually kind of see it or experience it before they actually engage.
Yeah, I will say that because where my office is located at Trager, it's been I sometimes have patients that are coming down to see me when one of those classes is going on. And it can be to your point, they can kind of see it happening and get an idea for what it would be like, which is a good introduction.
Mm-hmm. So many of us are not particularly thrilled about going into gyms because we're going to be judged. We're going to be, somebody's going to look better than me, or somebody's going to look at me, or I'm going to not know what I'm doing, or all those things. Then you have the added, additional limitation of walking or access, or, will I be able to get there? So there's so much of that going. Any other additional comments in the chat? Or I know that Mona is chomping at the bit. She indicated that in the chat, that she's so excited about taking all this information and bringing it into KCHC meeting. So if there's any additional comments, I think we are going to thank Kristen and Dena, and we are going to slide into our KCHC meeting with Mona leading. Thank you so much.
So, again, I want to welcome you, and our purpose, as we mentioned, is to train and empower stakeholders and community members to provide hope and education for their communities. And I think today's presentation has shown us how important that is. So if you'll go on. So I want to give the folks on here just a few moments that they could share any events that they might be having that they would like us to know about. And as I say often at our meetings, if you have something, if you would send that to Justin before our, like the day before, he will make it a part of our presentation as a flyer so that we can let people know. So just a moment, I'm going to be quiet and let you talk. Are there some events?
I did forget, Shelby is going to be leading a falls prevention workshop on, Shelby, is it December 6th?
Yes.
So we're going to have a falls prevention workshop on December 6th, I think at 11 o'clock. That's going to be hybrid, either in person here at the Trager Institute or over Zoom. And when I send out the email, I will include registration information for that. But Shelby, would you like to say anything about the falls prevention workshop?
Yeah, it's really just for anyone who, either caregivers or even anyone on this call who's just interested in improving their falls efficacy, their confidence in, being able to move better without fear of falling, but also learning how to fall safely, and also how to get up from the floor safely if you do have a fall. So, kind of touching on, I know there's been probably a lot of presentations on falls, but maybe some of those other mechanical issues, that might come up in the whole realm of fall prevention. So yeah, thanks, Justin.
Thank you, Shelby. And let me encourage you to share this information when you get it. I have heard Shelby. She spoke for us at My Health Matters, and she does a great presentation. So I know you'll learn a lot. Anyone else?
Right.
Okay, so do any of you have some concerns that you would like to share that perhaps we can help with? And feel free to put it in the chat if you want. Okay, let's go on, Justin. All righty, so we have started something new out in Henry County, and I'm hoping that it grows and other primary care providers, and well, not just primary care, but any type of providers will grasp this idea. But we're wanting our community to learn how important walking is. And so we've started the Walk with a Doc the first Saturday monthly at 9 a.m. out in Henry County. And so if you live close to us and you can join us, we would love to have you. You will see that you need to sign up ahead of time. But if something happens and you forget, or even you invite someone that doesn't have a computer, we will have a way to accommodate that out there. So this is something really important to me. I think that walking is one of the best things that we can do for ourselves. I actually have a PDF, and I don't know how many presentations that talks about walking. And there's over 100 health benefits to walking. And so we want to learn what those are, and we want to start walking. And again, I think that Kristen did a really good job of saying that we meet our clients where they are. And some of your clients may need to start walking by holding onto the sink in the kitchen until they get their strength and their balance so that they can get out. So we want to be careful how we prescribe these things. Okay, so go on to the next slide. All righty, so you've already heard me mention a little bit about My Health Matters. This is something that we do every Monday night, with a few exceptions of holidays that may fall on Monday night. And this one is strictly by Zoom. It started at the beginning of COVID from a class that I was doing on a monthly basis in person for folks who had taken classes with me. And we started this because we know that folks was going to be lonely. They still needed some help with their health, and we needed it too. And we have mentioned that we could go to once a month by Zoom and once a month in person when things got better, and there was a lot of resistance. They said no, they want it this way. And of course, it does meet the needs of even our professionals who get home and can have supper with their family and then jump on rather than going somewhere. So you can see some of the things that we're going to be doing. We're going to have so much fun. I just hope that you will share this with everyone and that you yourself will jump on with us. And you've some of the things that we do other than that is our Flourishing Together. And I really want to talk a little bit about that since it was brought out so much today, because what Flourishing does is Flourishing Together classes gives a really great, simple introduction to everything that Kristen was teaching us today. And we start out in a social environment, and they either sign up in teams or they make a team after they get there. The team names themselves and they come up with a mantra. We teach participants how to talk to their healthcare providers. And I think it's interesting that she said this, because I had it written down when I saw what the program was going to be about today. We teach people they have a voice and how to use that voice. And we help them see how important they are to the overall team, and they are central to it. We teach them the importance of education and knowing what their diagnosis means and how to manage that. We teach prevention as well, so you don't have to be sick to join Flourishing Together. It is a management and prevention program of chronic diseases. We talk about nutrition, we talk about movement, stress, self-care, mental health issues, all of the things that she talked about. And we talk about the good results, the good things that happen when we make these choices. I'm not one that teaches thou shall nots and try to scare people. I feel like if we know why walking is so good for us, we may be more encouraged to try it. So with that, I would say we need participants and we need facilitators. So if you have an interest, there is a way for you to contact me, and we hope that you will do that. Our Flourish program is what we started with in the very beginning, way back when. And our idea was that we wanted to help adults with multiple chronic conditions to improve life situations through a comprehensive care navigation program. And that's how we got started at Trager Institute, with just a few community health organizers in the community, and it has grown to this clinic and all these great and beautiful things. Our caregiver program is designed for caregivers of aging adults that are 16 and above to provide support and resources. And this is a survey that if you have an interest and would like someone from the caregiver program to give you a call. And even if you are a provider and you just want to know more about it, call them and let them explain to you what happens in the caregiver program. And of course, our virtual friendly visitor program was something else that started because of COVID. Before there was one, we wasn't in charge of it, but it was happening in our area where people were going into the homes. And once we saw that was not going to be able to happen, Barbara Gordon and several others jumped on board and was able to write some grants to get some tablets for our people, and got trained and got this program started, and it's flourishing today. And if a person is lonely or isolated, they need someone that can talk to them and give them encouragement. So again, if you want to know more about that program, let us know. We'll be glad to talk to you about that. Okay, so the Optimal Aging Conference is coming, and I'm going to yield this to either Justin or Barbara. I'm not sure who's going to speak to it.
So yeah, so thank you, Mona. So we've extended our call for presentations through November 27th. Our theme this year is aging and health equity. We're really trying to connect with people that can speak to a variety of issues around aging and health equity issues, speaking about direct patient care, community health workers. Pam and Barbara, if you want to chime in about other topics that would be really relevant, but we're really trying to, flesh out our program so it's, looking at a broad perspective on aging and health equity issues. So if you have a potential presentation you'd like to give, or you know someone who would be an excellent presenter, please refer them to our website, or they can email myself, and we'll get you more information. But we have extended that deadline for presentations through November 27th. Our friends at the Kentucky Voices for Health are having their annual meeting on December 5th. You can find a little more information here, and you can register for that conference through this QR code. But it looks like it's going to be an excellent conference, looking at bringing together stakeholders from across the Commonwealth to explore opportunities to improve the health and well-being of all Kentuckians. And so we really appreciate our friends at the Kentucky Voices for Health, and if you can learn more by clicking on that QR code.
Okay, so in closing, our pledge is that we will become an effective state coalition working with community members and community-based organizations to empower our state to become a healthier and compassionate people. And in order for us to do that, we must first practice self-care and model healthy behaviors to our families, our coworkers, and members of our communities. And I hope that that is how you feel and that you are doing that. If you want some help doing that, please consider joining our Flourishing Together classes. And we will be starting some more classes probably right around the 3rd week of January. What a way to start 24 is to learn more about your health.
All right, we're going to go on and do a 1-minute Zoom poll. It should pop up. If you go on and do that, that would be great to let us know. How was today's session?
Did the poll launch okay? It launched okay on my end.
I'm having a hard time, but I can't.
Might be because you're co-host.
Oh, that's what it is.
Put up our calendar. Note that our next session is on December 8th, and we're going to have Elder Angela Overton speaking about engaging faith-based organizations, putting person-centered decision-making into practice. You can register for our mailing list there on the right, and I will be sending out an email later today with a recording of the session and a link to the to register for that session.